Caring for the Children of Abraham, Chapter 2. I remember waking the next morning and thinking that the light was so bright and direct in Israel. The bed next to me was already empty. In the small white-walled room of the hostel, where we'd been bussed through the darkened Tel Aviv the night before, my roommate, a Jew. In Israel, I was told, one is a Jew, not Jewish, no scale, no apologies. One is Jew or one is not. He was rocking back and forth at his prayers, standing in the morning light at the foot of his bed near the door to a narrow balcony. He wore a skull cap on his head and a black and white prayer cloth across his shoulders. He looked upward, moist-eyed, raised his hands, palms up, cocked his head slightly, as though overwhelmed by something, and bowed his head again to his prayers. He finished and said, "I'm in Israel, we do this. We say thanks when we come home." We dressed and went down to the common area. Breakfast was something like a cucumber, beet broth, a roll with cheese and grapefruit juice. I think I found some coffee. Medical volunteers from the States asked for news about the war and where we would be going. We were told an Israeli army colonel was coming to talk to us. It was Friday. The Israeli army colonel was a tall, dark-skinned guy with a broad, kind face and a gentle manner. He was dressed in dull brown army working uniform. He said that the war effort had been going better than they had thought. He reviewed some of what we already knew: Israel surrounded by the armies of her Arab neighbors, threatened constantly by terrorism from the Gaza and the West Bank, with the threat of being shelled from the West Bank and the Golan Heights. Air superiority had been achieved on the first day. The successful battles at the UN headquarters, the old city in the Negev and Sinai, with a race to Sharm el-Sheikh. The sweep of the West Bank, the assault on the Golan Heights was underway and was going well. In fact, he said they really did not need us at all, and those of us who wanted to go sightseeing might do so. If any of us wanted, he would give us hospital assignments. Some of us said yes. We would like to help out if we could. I was assigned to Kaplan Hospital in Rehovot. The hospital was near an airfield, and as I was driven up to the hospital, fighter jet aircraft could be seen taking off with rockets and napalm canisters in racks under their wings, and planes landing with racks empty. The first anesthetic that I gave in Rehovot was for a large Israeli officer who had stepped on a landmine. His ankles were broken, and there was a great deal of soft tissue damage. The feet were swollen and denuded but alive. It seemed as though he had suppressed the blast with his huge body and forced it back into the ground where it had been hiding. On Saturday, I went to Jerusalem with a dentist. We had heard they were working around the clock in Jerusalem. The dentist, who had been working as a physician-assisted anesthetist in the hospital during the war, had not heard from his family and was anxious to get to his home in Jerusalem. I asked the hospital commander if I might be allowed to go with him, since we had few casualties at our hospital. He agreed. We drove over the road to Jerusalem. Traffic was heavy. There were buses of soldiers and flatbed trucks carrying tanks and artillery pieces. Hitchhikers were picked up immediately. Some were soldiers in uniform with their weapons going to their units. Everywhere around us there were biblical places. The road was the road in the movie Exodus, the relief of the siege of Jerusalem. At the dentist's clinic and home in the center of Jerusalem, we were welcomed into a living room full of family members. The clinic was on a corner. Across from the clinic, there was a women's hospital that was full of casualties from the fight for the old city. A messenger came from the hospital to ask the dentist to provide anesthetic service for 2 emergency operations. The anesthesiologists were sleeping off 5 days of working around the clock. The dentist asked if I would like to cover those operations, and I said sure. Went across to the hospital and, after introductions, suited up for the operating room. The first patient was a girl about 10 years old. I can't remember if she was an Arab or Jew. It was explained to me that you were a Jew in Israel, not Jewish, and I presumed that neither is one Arabish. The child had walked into a minefield and her feet were blown off. She was in shock. Before anesthetizing her, we had to stabilize her. While she received blood, I sorted through the anesthesia equipment for what I needed and went through the anesthetic machine checkout. The child had received morphine, the bleeding was controlled, and she was crying out for water. One of the OR nurses started across the OR with a cup of water for her, and I told the nurse twice not to give her water. The child had a full stomach. She had just eaten a noon meal, and her airway was at risk of aspiration until it was protected by the endotracheal tube. The nurse continued toward the child with the water. The Israeli surgeon told the nurse in Hebrew not to give the child water. The nurse continued with the cup in hand. Then the surgeon spun on one foot and with the other foot kicked the cup cleanly out of the nurse's hand without touching her. A beautiful, satisfying movement. The debridement of the child's leg stumps were carried out under general anesthesia without further event. We dressed the wounds and moved her to the recovery area. The second surgery was related to the first. The child had detonated the mine, lay wounded in the minefield. A man, also civilian, ran into the minefield to help her. His feet were also blown off. When we finished the 2 operations and our patients were pain-free, awake, and stable in the recovery room, I was shown around the hospital. The wounded were everywhere. There was a Jordanian major on a bed in the hallway. I winked at him, meaning to say, "I'm your friend too. I mean no offense. How may I help?" He looked into my eyes and said nothing. How can one be a proper guest in the middle of a family quarrel? Someone, an ambulance driver, or perhaps one of the surgeons, said they were working very busy at the Hadassah hospital and asked if I would like to go out there. I said, sure, I would. I went back across the street to the dentist's office and let him know where I was going. And then an ambulance driver took me through the Judean hills to what would be my home for the next few weeks, to be continued.